HPV is the most common sexually transmitted infection, and while many people don't ever know they have it, some don't find out until it's too late.
Doctors in the Rio Grande Valley are gathering to fight the infection, especially in rural areas. Freddie Vela has our special report.
MMR, hepatitis A, and TDAP are the most common vaccinations a child gets. And while the HPV vaccine is not mandatory, having your child get it could not only protect them from the human papillomavirus, but could prevent certain cancers in both men and women.
HPV is very, very common. About 80% of people get it. So essentially almost everyone gets it. Most people are able to clear it without any problems, but in a small percentage of women, it can persist and go on to cause cancer.
Human papillomavirus, or HPV, is spread through sexual contact. Right now, HPV is one of the main causes of cervical cancer, with more than 3 million cases diagnosed each year. The virus is also the main contributor to other cancers. There are hundreds of thousands of cases in men and women around the world. Unfortunately, more than half of those patients will die.
A lot of women who don't have the funding or don't have the insurances and aren't aware of the funding sources will go years without having a well woman exam.
The first HPV vaccination became available in 2006 with an emphasis on girls, but now doctors are urging parents to vaccinate boys.
Boys also need to be vaccinated because the HPV virus also causes other types of cancer, and one that's really on the rise is oropharyngeal cancer. Rates are increasing dramatically in the U.S.
According to the CDC, more than 3,100 new cases of HPV-associated throat and cancers are diagnosed in women, while 12,638 are diagnosed in men each year. Penile cancer is also on the rise in the U.S., with more than 1,168 new cases, most common among Hispanic men.
And then in addition, if we can get everyone vaccinated, it'll decrease the transmission rates and the rates of HPV infection in general and help protect the whole population.
Prevention care is key. To help low-income families afford medical screenings, Dr. Schmaler and the MD Anderson Group have teamed up with different medical entities across the Rio Grande Valley.
Clinica offers the HPV vaccine. In the Women's Health Department and our adult departments, we offer vaccines for our female patients and our male patients from 19 to 26-year-olds, and in our pediatric departments from 9 to 18.
Not only does Su Clinica, a nonprofit community health center, offer low-cost services, they assist patients in applying for the proper federal grant or services.
And through BCCS, if a woman has an abnormal pap smear and she's at or below 200% of federal poverty guidelines, has no insurance, and no other insurance such as Medicaid or private insurance, then we can qualify her for this program.
Even with clinics across the valley, transportation remains an issue for many who live in some of the poorest areas. The UTRGV mobile clinic travels from community to community, educating and providing services to people.
Well, the mobile clinic offers free medical services to indigent patients that don't have any insurance, of course can't afford to see a doctor, and they can come in and get the vaccines, and we do offer HPV.
On this day, they were set up outside a school in La Paloma, a colonia in San Benito.
Paul's goes in with the speculum, gets the broom, sticks it in there, just circles around a little bit with the cervix, and then pulls it out.
With each of these organizations working together, their goal is to stop HPV-related cancers before they form.
In general, that's a big problem, is that the pre-cancer or cancer in its very early stages has no symptoms. So people don't necessarily go to the doctor if they feel fine. And that's the importance of screening, is to find disease before it becomes symptomatic and before it turns into invasive cancer, or especially before it becomes advanced cancer.
Right now, there is no approved test to find HPV-related cancer in the mouth or throat. However, Dr. Schmaler tells us MD Anderson is working on tests for future approval. At this time, the doctors at each institution will continue to gather the data and share it in order to eliminate the threat over the next several decades. Freddie Vela, CBS 4 News and ValleyCentral.com.